Well, hello everybody, and welcome to the second day of the fourth Rapid Evaluation in Healthcare Conference. And just to be clear, this is a conference, not a party. So yesterday we explored the role of digital technology and AI in the NHS recovery and discussed the challenges that digital innovation brings. I should say that if you missed the sessions yesterday, you can watch again on demand, and it'll be the same for today as well. So my name's John Appleby. I'm the Director of Research and Chief Economist. I'm also co-director of the NIHR-funded Rapid Service Evaluation Team group, who are also partners on this conference, along with the Health Foundation and our sister evaluation organisation, BRACE. And I should say that if you want to learn more about our work, visit the About Us section on the event platform. So today we have two main sessions. In each session, you'll be able to ask questions using the question box underneath the live stream at any time. So please post any thoughts you may have. Doesn't have to be a question, could be a statement, I guess. You can also interact with other delegates by using the chat room, and you can click on the chat icon on the bottom right-hand corner of your screen. And you can also get involved in any conversations on Twitter, and I think the hashtag is Rapid Evaluation, all one word. Everything throughout the conference is recorded and will be available on demand in the coming days, as I said. So the first session is going to grapple with the evaluation agenda for perhaps one, if not the most important issue of our time, climate change. And the second will tackle an aspect of another defining issue of our generation, perhaps, the COVID pandemic, and explore how researchers, clinicians, commissioners, policymakers and others have worked together to carry out a rapid evaluation of remote COVID oximetry monitoring. And we'll be looking at sort of lessons learned there with that evaluation. At 10:30, we'll have a breakout session, and you'll be randomly allocated to breakout rooms. And my colleague from the Reset Sister team, Brace, Joe Ellins, is going to wrap up the conference with closing remarks. So let me introduce my colleague, Sarah Scobie, Deputy Director of Research at the Nuffield Trust, who will introduce and chair our first session. Sarah.
Thanks very much, John, and welcome everyone. It's great to be here virtually with you, even if not physically. So in the first session, as John said, we're going to be thinking about the evaluation research agenda for environmental stability in health and care. And as we'll all know, climate change has been rising up the agenda for governments and citizens globally, and that includes for health systems. And here in the UK, the NHS is thinking about what it can do to mitigate the effects of healthcare on climate change, but also understand how to address the health impacts of climate change as well. And I think there's a real moment here where we're moving from thinking about health and climate as being about the weather and hot weather and cold weather to something much broader about the impact of health services on environmental sustainability, as well as the other way around. So as the NHS becomes one of the first health systems to commit to net zero, I'm really delighted to be introducing this session, and we have three fantastic speakers. So we're going to start off with a talk from Dr. David Pension, who leads the NHS Sustainable Development Unit for England. And he's played a leading role in, over a number of years, promoting the benefits of sustainable healthcare globally, as well as in the UK. Now, David can't join us today because he's actually moving house, and you'll see the evidence of that when you see his talk, because he's surrounded by cardboard boxes. After David, I'll be introducing Sir Andy Haynes, who's Professor of Environmental Change and Public Health at the London School of Hygiene and Tropical Medicine. And Sir Andy has worked as an epidemiologist in the UK and globally, and his research is focused on the effects of environmental change on health. and what are the policies that can be introduced to mitigate these changes. And then our third speaker, very pleased to welcome Martin Court, who's Deputy Director of Data and Analytics for the Greener NHS programme at NHS England. And he's going to be talking us through what the net zero programme means and what some of the evaluation challenges and opportunities are related to that. So without further ado, if we could have David's talk, that would be great, and enjoy.
Hello, my name is David Pension. Thanks for that introduction, Sarah. So I was for 10 years, from 2007 to 2018, Director of the NHS and Public Health England Sustainable Development Unit, where we started a research program into many of the things that we're talking about in this conference. So I'll just give you a potted history of what we did and some of the lessons we learned, and acknowledge some of the people who did some of the hard work. So when we first started in 2007, we realized at that time, well, we thought there were two particular areas for investigation. One was the environmental impact of research, of doing research, and that's been extensively researched by Ian Roberts, who many of you will know at the London School of Hygiene and Tropical Medicine. But more importantly, we realized that we were going to have to do a lot of research to understand some of the ways in which healthcare impacts the environment and thus impacts health. And that was ably led, very well led, and I'm very grateful to Nick Black, also from the London School, who led a program of work on that for many years, which resulted in a publication in 2015 on technology, innovation, R&D for a sustainable healthcare system. And by sustainable, I'm sure it's been mentioned already, but it's important to remember that sustainability is really about doing today things that help, in healthcare, that don't knowingly mess up the future. So we're not stealing from the future. And that sustainable development agenda can be divided essentially into clinical, social, economic, and environmental. So it's the weaving together of those. So be careful in healthcare, people don't just talk about financial sustainability, because it's a much broader and interlinked and mutually reinforcing agenda than that. So one of the first things we realize is that, and this is a really important lesson for everybody, is don't invent metrics. We realize that we have to measure some of the things we need to do, like the pollution caused by the healthcare system, like the carbon footprint caused by the healthcare system, but don't invent metrics. There are many metrics already well developed out there that apply to the whole globe, not just the healthcare system. And it's really important to make sure they're used and they're incorporated, and they're bound in with other issues of quality. Sustainability is a dimension of quality in the healthcare system, just like equity or effectiveness. So it's important that it's bound in and it's quantified and it's made a core part. One of the big mistakes is in the healthcare system, we still talk about sustainability as an environmental issue, and of course it's a health issue. And that plays very much to the card of health professionals. The second issue about metrics is that one shouldn't wait for metrics. If there are no metrics available for you, don't consciously or subconsciously use that as an excuse to do nothing and say, I'm fully on board with this agenda, but I'll wait till the metrics are developed in 5 or 10 years. There are many, many things around the quality agenda of high quality healthcare that should not be put off, that pertains to sustainability in the broadest sense. So one of the first things we did was we did one of the world's largest, in fact, the world's largest scopes 1, 2, and 3 footprints of a national healthcare system in partnership with the Stockholm Environment Institute. And we found that actually, if the NHS were a country, it'd be a very large country. And we also found that a huge proportion of the footprint of the healthcare system comes from procurement, especially pharmaceuticals. Not exclusively, but that's a very big one. So there's a lot of work going on around pharmaceuticals. So don't start work programs on pharma without looking around and seeing who else is doing it. Because another sure lesson of this game is collaboration is key. We should not be working nor thinking in silos. There will always be somebody else who's got a very allied and complementary research program to yours. Fourthly, one of the very important points to remember is we're not just talking about greenhouse gases and the carbon footprint, although that is the predominant health crisis around the future of humanity. We're also talking about pollution, we're talking about waste, we're talking about biodiversity. So lastly, when we come down to specific rapid healthcare interventions, the evaluation thereof, of course, there are things around pharmaceuticals, about changing inhalers, changing anesthetic gases, better technology, leaner technology. But the real gains to be made over and above those efficiency measures are what we call transformation methods, when we're really talking about whole models of care. And by whole models of care, we're talking about, for instance, prevention of preventable illness, care closer to home, wiser and leaner healthcare, which is it's called in other countries. So this is about a systems thinking and system action about what the healthcare system is trying to do, not just to manage people with long-term preventable illnesses in hospitals, but actually helping people take control of their own health, take control of their own data, take control of their own determinants of their own health, keep people much closer to home, living a full and active life, whatever long-term conditions they might live with. And it's through that actually we stand a chance of reaching net zero. And don't forget, this country is looked at around the world in terms of healthcare system because we've made a lot of the pioneering steps. Not always successful, but at least we've been out there acknowledging this is a big issue, and the NHS in England has funded this agenda generously. So we need to support it with the research that's needed to make sure that the evidence is sound. NIHR are committed, I think, £20 million to this, but there are smaller grants for clinicians and others of 100k and 20k, and those people are interested in both understanding what the wider research agenda is and how they can be financially supported should contact Nick Watts or Natalia Kurek at the Green NHS team. And finally, just remember that we're not just talking about the harm, the environmental harm to the health service by thoughtless management of our resources and thoughtless management of our models of care. The healthcare system can do enormous benefit over and above its day-to-day clinical activities. And that is, for instance, in terms of its social value, in terms of it being, for instance, a huge employer, a huge procurer, a huge exemplar, and a huge partner to other sectors and systems, both nationally, locally, and globally. So I'll leave it at that, but I'm very happy to take up any questions. I'm sorry I can't join you live at this event, but I'd be very happy to take up and try and answer any queries anybody has. And if you want to contact me, do so on an individual basis by Googling me or contacting me through Sarah Scobie or John Appleby. Okay, thanks very much indeed. Bye-bye now.
Well, thanks very much again to David for recording that for us and giving us a great overview of some of the lessons from his work over the last couple of decades. And I'm now really delighted to hand over to Sir Andy Haynes to introduce some of the impacts and what we know about climate change and health. Andy. I think you're on mute, Andy.
Fine. Thank you very much, Sarah. Can I just check that you can see my slides appropriately?
Yes.
Good. So what I'm going to do is give a very brief overview of where we are now with climate change, and then build on some of the points that David Pension's already made about the importance of the healthcare sector and evaluating the environmental footprint of the healthcare sector. So first of all, where are we with climate change after COP26? This slide summarizes the sort of picture, and what you can see really is that we are already at 1.2 degrees centigrade global average temperature increase since the pre-industrial era. There's no doubt this is due to human activities. There's uncertainties as to how high the temperature increase will go, but really there's no doubt that humans are affecting the world's climate, and this is having an effect on health now and will increasingly have effects in the future. I don't have time to go into detail about what those effects are going to be, but they will range from the very direct effects of extreme heat, for example, extreme events like floods and droughts, the effects on communicable diseases, infectious diseases of various kinds, including vector-borne diseases, effects on air pollution through wildfires, through water availability, of course, is another important determinant, and that will affect crop yields, undernutrition, and then, of course, the more indirect effects, including increased poverty, population displacement, and probably conflict as well. So the effects are very wide-ranging indeed, and that is why it's imperative that we take urgent action to cut greenhouse gas emissions, and that means getting to net zero emissions by 2050. And the slide shows us that we're likely, if we're very optimistic, we might get to 1.8 degrees. Remember, the Paris Agreement says we have to keep well under 2 degrees. Most likely, though, we're headed to something like 2.7 degrees centigrade, something of that order. So COP26 there were some advances, but in many ways it was a predictable disappointment. So what do we need to do in order to minimize the health effects of climate change? And there are two broad types of action that we need to take. One is mitigation. Now, in climate change terms, what mitigation means is action to cut greenhouse gas emissions. That's carbon dioxide is the big one, of course, but also methane and a range of other gases as well, some of which all of which are related to human activities. But we can't prevent all of climate change, as I've already mentioned. So we have to adapt to that climate change that we can't prevent. So mitigation and adaptation are crucial actions, and they need to be integrated as far as possible. The focus today, I think, is very much on cutting emissions from the healthcare system. But any evaluation needs to evaluate the extent to which we're successful in reducing the impacts on health of climate change. And in the UK, that will be, of course, heat, floods, probably our food system as well, because we're increasingly importing food, fruit and vegetables, for example, from climate vulnerable countries. So there are a range of impacts that could occur in the UK, as well as the broader global impacts. And when we look, as we've already heard from David, at the healthcare system itself, we see that the healthcare system is quite a significant driver of climate change. The Healthcare Without Harm report informed us that if the global healthcare system was a country, it would be about the 5th largest emitter, something of that order on the planet. And a lot of work's been going on, including that led by WHO, on developing climate resilient and environmentally sustainable healthcare facilities. And at COP26, 52 countries committed to building health systems which are able to withstand the impacts of climate change and which are low carbon and sustainable. And 14 countries, like NHS England, for example, have set a deadline of 2050 or earlier, by which time their health system will reach net zero emissions. So quantifying that progress is going to be crucial, because, to be honest, there's an awful lot of aspiration at the moment. There's an awful lot of declarations of intent, but actually when we look at the action, it's grossly inadequate. So evaluation is going to be absolutely crucial in order to distinguish between what we might call greenwash and real action, and also to give us a credible picture of the barriers and the enablers of change. So it isn't just, I think, measuring quantifying the effects on greenhouse gas emissions or in climate change impacts, but also understanding the contextual factors which enable us to move more quickly to a net zero carbon economy and a net zero carbon healthcare system. And let me say that although the focus today is on the healthcare system, the really big benefits to health will of course come from actions to reduce greenhouse gas emissions in a range of other sectors. So decarbonising the energy system, the transport system, and of course food and agriculture, more sustainable and healthy diets, because land use change, food and agriculture are responsible for about 30% of greenhouse gas emissions, something of that order. So the health co-benefits of preventive activities, as David Pension referred to, are going to be really important, and there are major co-benefits of moving towards a more sustainable economy. You've already heard from David about the different scopes of emissions, and these are indeed really important from the evaluation perspective. So distinguishing between these different scopes of emissions, the scope 1, which is very much the energy generated on site, the scope 2, which is electricity brought in from the grid, scope 3, which is a range of emissions from supply chains, for example, and I'm sure Martin will talk more about those. And there's a lot of work going on, as you've already heard, in conjunction with the pharmaceutical industry and to some extent with the medical equipment industry to try to reduce emissions. And it would be really important to evaluate the successes of those. The carbon footprint of the NHS, as we've already seen, a lot of it's due to these emissions that are embedded in supply chains. And you can see that the breakdown of these on the left side of this slide, the circular diagram. You can see how the different aspects or elements of carbon and greenhouse gas emissions more generally are illustrated in the pie chart. But on the right side, you can see how these activities relate to the NHS activity type. So as you'd expect, a lot of the energy use, of course, is in the hospital sector and the acute care sector. But when we look at pharmaceuticals, of course, it's primary care general practitioners that have control over a great deal of the prescribing. And so actions to reduce unnecessary polypharmacy, for example, can improve human health, but also reduce greenhouse gas emissions. And to some extent, they're in control of healthcare professionals. There are specific issues like anesthetic gases, David referred to. Desflurane is a potent greenhouse gas, for example. Asthma inhalers are moving as far as possible to powdered inhalers away from these climate active propellants. So there's a great deal that can be done, and we need to monitor very carefully the particular climate hotspots, the greenhouse gas emission hotspots of the health service, to ensure that those are indeed reducing their emissions. And we do know, thanks to the work of David and his colleagues, that the NHS has already achieved a great deal. And you can see that there's been a reduction of 26% since 1990, something of that order, the total NHS emissions, and a decrease of nearly 2/3 in the emissions per inpatient finish admission episode. But what you can see from this slide is that there's been more progress in some parts of the emissions spectrum and less progress in others. So we have seen a reduction in energy-related emissions, and that's largely been due to the decarbonisation of the UK energy grid, of course, which is still underway, but much less progress on the supply chains, as we've already discussed. A lot of work to be done then on those, on also on food systems in healthcare facilities, for example, on transport of patients and staff, encouraging more use of active travel, for example, for staff where that's feasible. So in conclusion, I don't know how clearly this slide you can read it, but what it attempts to do is to map out the various hotspots and the various mechanisms and pathways by which the greenhouse gas emissions in the healthcare system can be reduced. And you can see that there's a wide range of activities that can contribute to the reduction of greenhouse gas emissions, right from the obviously much more energy efficient health facilities using low carbon sources of energy to changes in diet, in food systems, in transport systems, in procurement, as we've already heard. And so it's through a combination of different strategies to tackle these different scopes of emissions that we can reduce the carbon footprint and the broader environmental footprint of the National Health Service. Evaluation, as I say, is going to be absolutely crucial, because we have to ensure that it's not just hand waving, that there's real reductions in greenhouse gas emissions. And I think that the world will be watching the NHS, because the NHS is seen to be a pioneer in this area. And so the successes and failures that we experience in this country is going to be a very important source of lessons for the world more generally. So I'll stop there, and thank you for giving me the opportunity to speak. Obviously, there's a lot more I could say about climate change and health and about the role of evaluation, but I think it's absolutely crucial that we are much more effective in monitoring and evaluating the progress that we hope to see over coming decades towards net zero health systems. Thank you very much.
Thank you very much, Andy. That was excellent, really interesting and informative, and really sets the scene. And I can see we've already got one question coming through for the audience, and do please post your questions in there. There's going to be some time at the end for discussion, so it'd be great to hear from you if you've already started to think about how you might bring some of these issues into your work as evaluators. So at this point, I'm delighted to hand over to Martin Cornt from the Greener NHS team at NHS England.
Thanks, Sarah. It's always difficult following someone like Andy and David, but as you can tell from my potted history, I have a background in evaluative research in healthcare, and more recently I'm leading the data analytics to support environmental sustainability in the NHS, and specifically the action we're taking to reduce carbon. I'm really delighted by the chance to speak to you today. I hope I will do my bit to inspire you to play a role in tackling what John described quite rightly as the biggest threat to our way of living and our health as a nation. So I think both speakers have touched on this, but climate change really threatens the foundations of good health, with direct and immediate consequences for patients, for the public and the health sector. It really matters. It's not something that is sort of a separate objective of the NHS. It's part of what the NHS is here to do. David's spoken a little bit about the history of sustainability leadership in the NHS, supported through the work that he established in the Sustainable Development Unit, and now is being taken on by the Greener NHS programme. And the NHS has actually set some very two clear and feasible but ambitious targets for itself on getting to net zero. So for those emissions that we control directly, referring back to Andy's chart, the scope 1 and scope 2 broadly, we've committed to get to net zero by 2040. And then for the emissions we can influence, those include those that are scope 3 and beyond scope 3. So those things are to do with patient travel, for example, and staff travel by 2045. So that's before 2050. It's ambitious targets that we set ourselves. Crucially, almost all the efforts that we are taking to reduce carbon will either result in improved patient care, increased efficiency, or long-term cost savings to the NHS. And this is important because actually, making the case for these changes can sometimes be hard. It's easier if you can demonstrate there are wider benefits from the changes we're making too. The thing to say here is that as we are the first to commit to doing this, we are exploring uncharted territory. We often talk about in the programme that we are building the plane as we're flying it. Sometimes it feels like, we're also refueling it and, add a few more complications too. So we do rely on research and innovation to help us to get there. We really will need the support from the research and evaluation community to help us to identify those things we don't yet know that will get us to net zero. David mentioned the work by Dr. Nick Watts. So Dr. Nick Watts is the NHS's first Chief Sustainability Officer, and he's the director of the Greener NHS programme. And the work that we are doing to help support the research agenda. So we are working with key partners, both domestic and international, to try and incorporate environmental sustainability in their work. What we should say is that the evaluation research agenda in health and care research is a growth area. There's lots of potential to get involved and, as described, to make a real difference. So a few examples of that. In the NICE strategy that was published last year, there's a commitment to include environmental impact data in NICE's guidance, and they also are working with academic partners to develop a framework for quantifying environmental sustainability information. Obviously a really important lever for change. Last year, the Greener NHS programme launched the first net zero focused small business research initiative in healthcare competition. So here we were seeking innovations to reduce emissions across surgical procedures, travel and transport, low carbon decision making, and the use of nitrous oxide, which is one of the gases that Andy mentioned that has a high global warming potential. So phase 1 of that's closed now, and it's really exciting day today. The winners are going to be announced at midday, so look out for that, and see the people that are and the innovations that we are investing in through that scheme. David mentioned the investment by the NIHR. So they've launched a research call to support the delivery of net zero health and social care system. So they're looking for applications to reduce carbon emissions in care pathways and health and social care services. This includes implementation or the service redesign models. Again, an opportunity there to do some research and evaluation of changes that will make a difference and make a contribution. And then finally, in January, the MRC launched a funding opportunity for research that improves MRC's understanding of environmental sustainability in life sciences and medical practice. So just an example over a few months of the expanding research and evaluation opportunities in this area. So David quite rightly spoke about that this is not just about carbon reduction. I will unashamedly though focus on carbon, because that is the principal focus of the Net Zero report, and it's our route into supporting the wider environmental sustainability actions that the NHS can take. In the Net Zero report, which was published in October 2020, which some of the charts that Andy showed are taken from, we set out trajectories of how we will get to net zero, how we believe we'll get to net zero, and the actions required by the NHS and its partners by delivering direct interventions. And as Andy indicated, these interventions happen across the scope of the NHS. So within its estates, within the travel and transport associated with healthcare, our supply chain, the medicines that we use, but also in enabling actions. So David talked about sustainable models of care. We need to deliver care in a different way if we're going to get to net zero. Looking at the workforce and the contributions they make, and also leadership. All of those areas would benefit from understanding of how and why the changes are having an impact and how they can be applied elsewhere. So there are obviously opportunities there for evaluative research. But some specific areas of focus could be models of care. So we need to change the way that we deliver health and care so that it's more sustainable and supports the wider ambitions on net zero. There's lots of pockets of sustainable practice throughout the health system, good examples in the NHS. These obviously need to be expanded and spread to cover all health and care activity. It's imperative, as Andy mentioned, that we quantify the impact of the emissions and ensure that whilst we may be reducing emissions in one place, we're not inadvertently increasing them elsewhere. We also need to understand what impact on health outcomes these changes are making, because that gives us a much stronger case for change than just focusing on the carbon impact alone. And he mentioned adaptation, so climate resilience is also an important area. We need to build and understand the evidence of the impacts of climate change on health and service delivery, and we need to help to build the resilience into the health and care system. Yes, we need to try and mitigate the impacts and try and get us close to below 2 degrees as we can, but there are going to be impacts on the NHS, and we need to ensure that the changes we make also make the healthcare system more resilient. And then finally, I think both Andy and David spoke about procurement. So if you look at that pie chart that Andy showed, you will notice that a very large proportion of it is related to our supply chain. We've made commitments in the NHS to no longer purchase from suppliers that do not match our ambition from the end of the decade. And we set out a framework at our public board up before COP about how we will get there. But this is going to require change from purchasers, suppliers, patients and staff. So there's an opportunity there to look at how we can support that behaviour change. So to finish, I think that one of the key points I want to get across, which I think Andy and David have too, is environmental sustainability is not separate from what we do in the NHS. It's a core business of the NHS. As David has said, it's part of the quality agenda. It must be built into everything that we do when we're looking at the effectiveness and the quality of the services we deliver in the NHS. So the challenge for all of us is how can we make sure that the decisions we make in health and care consider the costs and the impacts of the changes we're making on the environment. As David has said, collaboration is going to be key. There's lots of work out there that we can build on and adapt and use to tackle this challenge. So a couple of questions we might want to get into in the discussion is, how can we learn from environmental evaluations that may not have been done in health, but could have applicability to the health context? How do we adapt and apply them? But also, how can we learn from some very complex health evaluations that have been done and think about how we can use the metrics that David has explained are already there and expand those evaluations to include the climate change context? So I'll stop there and I'll look forward to the discussion.
Thank you very much, Martin. That's great, and a great segue into the discussion. And we've got quite a few questions already coming from the audience. And I think perhaps we'll start with the point about data and metrics. And there's a question here about where the data comes from to assess the contributions to emissions. And I guess there's a broader question here about where would health service researchers and evaluators go to look to get to some of that data. I don't know who'd like to kick off with that one.
Well, shall I have a quick start and then others can jump in? The data, yeah, so data comes from different sources. The NHS itself has been quite a pioneer, as we've already heard from David, in the collection of robust data around greenhouse gas emissions. And it's very much an international leader in the field. But there is international collaboration going on now to develop robust kind of metrics of carbon footprinting of health services. That's obviously relatively easy for scope 1 emissions, because obviously you can measure the carbon intensity of a national energy system. You know where you're procuring your energy supplies from, so it's not difficult to calculate the greenhouse gas emissions. It's much more difficult for the scope 3 emissions, because there you're dealing with very complex supply chains. And I happen to sit next to a very senior executive in a pharma industry recently at a dinner, and he said that they themselves, this company, had no less than 50,000 suppliers themselves. So for them to truly measure their environmental footprint gets very, very complex. And they were having to conduct a big exercise in actually training their suppliers in measuring and monitoring their own greenhouse gas emissions. So it is quite challenging. And the scope 3 emissions are essentially largely, they are approximations, if you like, because it is a complex situation. But you can get at least a rough approximation of greenhouse gas emissions if you know, for example, the carbon intensity of the country from which you're importing your goods from, and the energy requirements of the processes needed to make those products. Then obviously you can make some reasonable estimates of the greenhouse gas emissions, and indeed the other footprints as well, like the water footprint and others. So no perfect, it's not a perfect system, and it's being improved all the time. But there is at least there's been quite a lot of work in this area, and there's increasing standardization. But Martin may want to come in too.
Thanks. I think that gives a really good picture of the situation around data. So the NHS is awash with data. Some of it's good quality, some of it less so. In the area of environmental sustainability, it is improving. So there are areas, as Andy said, where there is recognised and long-standing collections. One of those is estates return collection, as Andy talked about, much more tangible part of the scopes of emissions. So I think that's published by the NHS Digital and is available. There are carbon intensity factors that you can use to translate those returns into carbon figures and so on. So that's a much more tangible, but there are gaps that we need to build on. One of the big ones Andy talked about is procurement. We don't yet know the carbon intensity of each product that is purchased across the world. This is not just a health issue, this is across society. There isn't the information available at the moment to help a consumer to understand, if I buy this as opposed to this, there's a lesser impact on the environment. And that's true also in the NHS. So as part of the work we are doing and the commitment we've made around procurement, we are establishing a framework that will get us to a place where we'll start to get that information and have a much better understanding of the supply chain, the choices we might make, and some of the challenges we might have on particular parts of the supply chain where we need to buy these things, but at the moment the impact on the environment might be quite high. There are other areas which are challenged too. So part of my job is to start to fill those gaps. So we're starting to do that. In the time I've been in post, we've improved our data in the area of the fleet, so the vehicles that we use in the NHS to support the operations, around ambulances. We're looking at food, and there are a number of other areas too. So bit by bit, we'll start to improve the data that is available to us to support the work that we're doing. And I can hear the researchers crying, but how do we get hold of that too? So yes, I'm aware of that. Sometimes there are challenges. Information governance is a friend and an enemy at the same time. And sometimes there are challenges about making that data available. But we are aware, if we are going to get the support from this community, we'll need to make data available beyond the boundaries of NHS organisations. So that is on the list of things to do, but it may be a few years, months away from being able to make all of that available. But there is data out there.
Thanks, Martin. And you preempted my follow-on question, but I'm going to have a follow-on suggestion instead, which is that maybe we need something like the PSSRU book of costing, to have a book of environmental costs and some standard ways of incorporating those, because I think that's going to be of interest to a lot of people. So another. Sorry, do you want to come back on that one?
There is stuff. The Green Book explains how you apply things related to carbon. It's not quite as you can use that, and we do. But you're quite right. Having a consistent way and a consistent set of factors and approaches to doing things is something that we need to put out.
Great. So quite a few mentions of complexity, and there's a great question here from Jeremy Wyatt about an evidence map and the idea of constructing an evidence map of positive and negative linkages and how all the different parts fit together. Be interested to know if something like that is already been done, being worked on. Any thoughts on that one?
Yeah, shall I come in there, Sarah? Because this is a very timely question, because we're actually developing these kind of evidence maps at the moment for another project that we're doing funded by the Wellcome Trust called the Pathfinder project, which is really essentially documenting those pathways by which we can both safeguard the climate, in other words, cut greenhouse gas emissions, but also improve human health. So the obvious pathways like reducing air pollution through clean renewable energy, improving nutrition-related health outcomes through healthier, low environmental impact diets, more sustainable transport systems, more sustainable healthcare systems, as we've been talking about today. So we are mapping out those various pathways at the moment, and we're doing a series of systematic reviews and overviews to map out the whole kind of research evidence base. And we're finding that it's quite patchy, actually. Much of the research, unfortunately, is of relatively poor quality, and people are using different metrics and different timescales to quantify the greenhouse gas benefits of different actions and interventions. And even the health outcomes are not uniformly characterized. So at the moment, it's quite a, I was going to say mess. I mean, there's obviously work has been done, but it's not been done through using consistent standards and consistent guidelines, and it's a bit like perhaps some clinical trials were 30 years ago. You know, we need to actually improve the quality and the consistency of the data collection. So the mapping is started, but I agree with you, it needs to be prioritized a bit more. And certainly if you're interested to know more or interested to collaborate, contribute, then please send me an email separately, you know, after this meeting. andy.haynes@lshtm.ac.uk.
Thanks, Andy. Martin, is there anything you'd like to add there, or maybe I'll post you the next question?
I'm interested in that work, Andy. I was aware of it, so I may follow up after this. It is something that's been discussed in my time, and we had an advisory group that supported us in the development of the Net Zero report. It's sort of that systems thinking idea was brought to the discussions there. I don't think we've done it in the way that's behind the question. But I think there is some value in doing that kind of mapping. So I'd be interested in any work in that area.
Great. So the next question, actually, I'm going to turn to is about cost effectiveness. And so this is an area where there's been, you know, huge developments in methodology and standardized ways of approaching things and building in cost effectiveness into evaluations much more routinely. Are we now in a place where we need to be evaluating the environmental costs as part of those studies? And indeed, how would you cost up what the extra cost would be of implementing more environmentally friendly approaches rather than less? I don't know if Martin, you want to start us off with that one?
So I think that's part of the challenge that NICE has set itself. And how do you consider the benefits that new technologies, new approaches may bring alongside the wider environmental impacts that they have? So that work is ongoing. I mean, it is a real challenge, isn't it? Because the NHS is there to support the health of the nation, and it also needs to be sustainable from a financial point of view too. But I think this is where we are now moving into. We need to understand actually that without taking account of the impacts on the environment, you're not taking account of the full costs of the changes that you're making. So I don't think we have an answer. I don't have an answer to that question. It's certainly being considered as part of the work that I think NICE will need to be looking at as part of their commitment to their strategy and looking at this area. In the work we do, of course, we need to understand the full impact. So that also includes the costs of any changes that we make. So, you know, the things that we're doing nationally, we will look at the costs alongside the benefits it will provide to carbon and health where we can.
Sarah,
Martin,
maybe I can
Andy,
just come in there. Yeah, because I think one of the challenges we have is that in our current economic system, we don't really take into account the full economic cost of our activities. So, you know, if we fill up a diesel car at the pumps, we don't take into account the effects, the costs, for example, of the air pollution from the particulate matter or the NO2 coming out of the back of the diesel car. So our economy is based, in many cases, on not paying the full costs of externalities, what economists tell us are externalities. And once you start to internalize those costs, of course, then the low carbon, more sustainable options become much more attractive. So you could argue that it's kind of an artifact of our economic system that actually we don't pay the full economic cost. One of the great challenges, though, of course, is the time period. You know, given that climate change, for example, is going to roll out over decades, centuries, millennia. And of course, if you apply discount rates, then you can discount away all the costs of climate change. So it is a complex arena. But one way to look at it is just to put some kind of social cost, to factor in the social cost of carbon, you know, which needs to be at least $100 a ton, really, probably more, in order to reduce greenhouse gas emissions, rapidly move to a net zero economy. And we need to take into account the environmental impacts of the products that we're consuming, both we as consumers, but also the NHS more broadly. So it's a challenge to conventional economics, but I think it's one that we need to rise to.
And I mentioned the Green Book, Sarah. So there is guidance in there about, and there's a cost of carbon that you can apply in, your assessments, appraisals of changes. Yeah. So there is a way in which the carbon calculation, the cost can be made. I think the real challenge is, what do you do with that information? Do you make a choice not to invest in something that will have a significant health impact if you believe it also will have a very significant environmental impact? That's the really difficult choices. I think the best we can do is make the information available, and then you can make a decision based on full information. So I think that's where we should be going, to understand the trade-offs, the decisions we're making when we're doing things. As Andy says, this is challenging for society. It's not just health. We're just feeling it in health too.
Thanks both. So next question is something broadening out to a different area, really. What do we think in terms of social and behavioural sciences, and how might they contribute to this agenda? Is there much linking up between researchers with those coming from those disciplines in this area?
I mean, if I could, shall I start? Yeah, so I think, this is really a big growth area. And I think it's absolutely imperative, the involvement of the social and behavioural sciences, because a lot of this is about behaviour change, both of us as individuals, but also society and groups more generally. So there is a range of research going on how we can change human behaviour towards more sustainable trajectories. Some of those levers, of course, are economic. So if we just price things differently, if we have carbon taxes which are well designed so they don't disadvantage poor people, that could drive behaviour change quite substantially. As Teresa Marteau has pointed out, and she's thought about this quite a lot, that a lot of our actions are kind of unconscious. So what's really important is to make it easy to make the right decisions. So more sustainable transport systems, it won't be just by urging more people to get on their bicycle. It'll be by making walking and cycling safe and easy option, rather than just urging people to cycle more, for example. Likewise with food, there's been studies showing that if you place the kind of healthy, low environmental impact food choices right at the front of the menu, so make them very, very prominent, then people are much more likely to choose them. And once they start choosing predominantly plant-based foods, they often stick with that choice. They may not become totally vegetarian or whatever, but they do change their dietary pattern. And in fact, there's already evidence that is occurring. There's been a reduction in the UK in meat consumption and an increase in the consumption of predominantly plant-based foods over recent years. So behaviour change is occurring, particularly amongst younger age groups, rather than the older and middle age, but change is already occurring. So there's a range of different approaches that we can take, everything from warning labels to placing products, to financial, to tax and economic incentives to stimulate behaviour change. And it's a very, very fruitful and important area for research.
Thanks, Andy. Anything, Martin, that you'd like to?
So I totally agree. Totally agree with Andy. This is all about behaviour change. Dr. Nick Watts, my boss, often says, we're not going to get to net zero unless we all get to net zero. It's just everyone has to change. So there's perhaps some tangible examples. We are already drawing the expertise of behavioural scientists within the organisation to advise on things like guidance and helping to inform patients about choices that they can make, which would have an impact on their health, lead to better outcomes, but also lead to better outcomes for the environment too. So looking at how we position, how we provide information in a way to, as Andy talks about, to make it easy to make the right choice. I think the issue around procurement and supply chain will very much require that kind of approach. Making information available to people who are purchasing, people who are consuming products, to understand the choices they're making and the impacts they're making. So yes, there is a big opportunity for social scientists and for behavioural scientists here. Perhaps picking on the social scientists a little bit more, one of the values of evaluation is understanding why something is effective when a change is made. So, that more qualitative evidence that we gain from really good evaluation. So clearly there's a role here to understand how we can effectively roll out changes that have been successful in one place, so that they can be successful in other places. So yes, big opportunity in that space too.
That's great. I think there's another question here about examples of sustainable delivery. Are there examples in the area of procurement, say, where changes have already been made, and where we have evaluation in place already?
I don't know whether Martin wants to come in, but my take on this is very much work in progress. There isn't a kind of utopia out there where people are delivering very high quality care with a net zero emissions, for example. So it is still an opportunity for mutual learning. At the national level, there are very big differences in greenhouse gas emissions, per capita greenhouse gas emissions. And some countries seem to achieve quite high levels of health, relatively low levels of emissions. We could think, for example, of countries, mainly fairly small countries like Costa Rica, Uruguay, Cuba, even Albania, interestingly enough, Jamaica, there's some recent analysis that we've been doing, show that you can have quite high levels of healthy life expectancy at relatively low environmental footprints. Now, that's just not an issue of healthcare. Obviously, it's also an issue of equity, of the kind of broader social determinants of health. So there are some countries that have made more progress than others. But in terms of the healthcare system, those countries which have very low environmental footprints are often those which haven't achieved universal health coverage. And so it's a question of optimizing, of achieving universal health coverage, high levels of cost-effective healthcare, but very low environmental footprints. And that's really very much work in progress.
Just to pick up on that, so I think it depends on what's behind the question, Sarah. So is there an example of a health system out there that's sustainable? I think the answer, as Andy's indicated, is no. Those that may be low, have a low impact on carbon, may have low activity, and that's one of the challenges. One of the best ways to reduce the carbon footprint of the NHS is to reduce the activity of the NHS, which is clearly not the approach that is going to be successful. There are pockets out there. So for those that like searching on the internet, go and have a look for the public board report that the Green NHS programme produced to our public board, where there is lots of case studies around the things that are happening in the NHS to make the changes and reduce the carbon, which Andy pointed out. We have made progress. There's much more to do. So there are pockets, there are examples out there. And then there are things that will stimulate innovation and new ideas that we will need to quantify and understand and roll out. But I don't think there's one example you can go out there and say that's what we need to do here. The NHS is leading. There are 14 other health systems that are following on, but we're still in a situation where we're creating the path.
Well, it sounds as though there's plenty of scope as we go on this journey to also learn from the experience of other countries. So it'll be great to kind of keep that in mind. We're more or less out of time. There was one question about having a minimum data set, which sounds like a great idea for a minimal environmental data set that could be applied across projects, and I think that builds on our earlier discussion about data sources. And then one other question that's come through as well in relation to the pandemic and testing and the whole COVID testing infrastructure and what the environmental implications are for that, and perhaps that's something that could be picked up as well in the next session. But I'd just like in the last minute or so to say a really big thank you to David. Hope his house move is going well, and to Martin and Andy for a really fascinating set of presentations, and to the audience for some great questions. And I've certainly come away with lots of ideas of things to think about further and follow up, and I hope that's been the same for you as well. So it just at this point it's for me to hand over to our breakout session for today on patient and public involvement in rapid evaluation, and just to say that you should automatically be directed to a breakout room. If at any point you have a connection issue and you drop out, then just go back to the platform, and you can rejoin from there. So hope you enjoy the next session, and thanks very much again for listening to this one and contributing, and to our great speakers. Thank you.